first sutra of Patanjali is Yoga Chitta Vritti Nirodha. He says yoga is to bring down the afflictions of the mind. So that is my core theme.
Hi, I'm Nidhi and I'm an expressive arts therapist. I bring together a variety of modalities in my work with clients. I work across a spectrum of mental health concerns. I'm excited about the series of conversations that we are launching with wellness experts from a variety of domains. With me today is Dr. Raksha Bhide. Dr. Raksha Bhide brings in with her a Ph.D. in Yoga and Psychiatry from the Department of Psychiatry at Nimhans Bangalore. She's very passionate about integrating a mind-body approach to working with clients across a spectrum of mental health concerns. She specializes in working with maternal mental health and has worked with 1,000+ clients. I'm very excited to be doing this with you today.
Hi Nidhi, thank you for having me on the podcast series. Happy to be here.
Yeah, I'm actually very curious about this very interesting modality that is rather new, is not something that we hear about a lot. And before we delve deeper into clinical yoga therapy, I'm interested in hearing your perspective about holistic health.
Right.
This is a word we hear a lot these days. What is your opinion about what truly is holistic?
Okay. So I think that yoga and holistic is quite synonymous with each other, right? There's no taking away of one from the other. Diving down into a very basic question, okay, and what yoga is centrally themed around. Let's look at breath. Yeah? So if I'm talking about how we breathe, and if I ask you, so Nidhi, when you are, let's say, stressed or worked up, right, or let's say you're very angry, then have you noticed how you're breathing?
Yes.
Yeah, so how is your breath then?
I noticed that when I'm angry, my breath becomes fast and shallow, and it feels rather labored. Yeah.
Okay, wonderful. And what if, when you're really relaxed or calm, maybe you're having your cup of tea, right, in your balcony. So how is your breath then? Have you noticed how you're breathing?
Yes, it's rather slow, or I would say moderate, rhythmic, and it seems to reach my belly.
Right.
We're just staying here in the chest.
Okay, amazing. Yes.
Yeah.
So we know that how we feel has an impact on how we breathe. Right? So our breath is kind of a mirror of how my mind is. So if I'm stressed, then I know my breath is really shallow, like you said. I feel tight. It's very labored. So now in clinical yoga therapy as well, when I look at holistic health, now let's say breath is something tangible. Now I can't immediately go and change how I feel. I can't tell you if you're going through a stressful time and I say, Nidhi, don't feel stressed.
Yeah.
Not going to work.
Yeah.
Right? So then can I change how I'm breathing so that reflectively then I change how I feel? Right? That's the entire crux of it, because I know my breath is not separate from my mind. Now let's see what happens to the body. A lot of times when you are stressed, or let's say when you're very sad, like we tend to hunch.
Yeah.
We tend to probably hug our knees, sit down like that.
Yeah.
Right? And if you're very confident, right, and you're walking somewhere, then how is our gait? How is our posture?
Yeah, like the chest opens up and the shoulders feel upright and the body straightens.
Yes, and that's also very reflective of the asana practice. Right? A lot of asanas where we tie down to maybe animals, we look at how the posture is. We say proud as a peacock or like a lion's chest. So we're opening the chest. So I know that my body is also not separate from my emotions. Right? My posture mimics how I feel. So then can I use my body again as something very tangible to change how I feel? Right? So then for me, holistic is this. I'm not looking at my mind separately, my breath separately, my body separately, but it's coming together of all of this. And this can happen on the mat for me when I'm doing my practice. Very simply put. Yes? So now let's look at it with regard to breath work, let's say when it comes to autonomic nervous system.
Right.
And if I have to just brush, so what is autonomic nervous system? That's something that's happening involuntarily in my body. All these systems that are functioning. So I have my digestive system, I have my nervous system, I have my respiratory system, I have my cardiac system. So all of this is involuntarily functioning for me. Right? I don't really have a lot of control over it.
And thank God for that.
That's the autonomic nervous system. But the greatest, biggest news, the eureka moment here is when it comes to respiration, although it is a part of our autonomic nervous system, I still have some control over how I breathe. Right? So when it comes to my breath, I can probably modify. I can breathe a little slower. I can train myself to do that. So then what happens? If I can change how I breathe, that has an effect overall, impacting all the other systems. My heart rate variability shifts, right? My heart health is better. I know that my cortisol is going to dip. My hormonal system is regulating. And I know that has an effect on my immune system. I know that overall, if I could actually change just how I breathe and do this consistently over a longer period of time, it has an effect on the entire autonomic system. It has an impact also, research tells us, on the way that our brain neurons fire. Right? So I am causing this shift just by breathing and retraining myself to breathe consciously better. Yeah. So I'm having an entire, it's like an orchestra working. And I'm having that effect just by doing this. Yes. So for me, this is holistic health. Now let's look at it from another angle. It's not a quick fix. So if I have a lower back pain and I come in, yes, you can take painkillers. Painkiller will immediately bring your pain down. Your symptom is managed. But what do I have to do for it to get better long term? Maybe I have to work on my posture. Maybe I have to start strengthening, doing some stretches around to strengthen those muscles. Similarly with mental health. If I have anxiety, I know that my symptoms can be taken care of immediately, maybe by medication, because it is real, because I need to control my symptoms as well. I have panic attacks, right? I know that physiologically I'm aroused. But in the long term, how can I manage it? Are there tools and techniques that I can learn so that I can apply this over and over again throughout my life? Because that's not a quick fix. I know that I'm going through challenging situations. I know that stress is going to be a part of my life. There's no going away from it. Every change can be a stressful situation for me. So can I equip myself with tools that I can help myself with, that I can fall back to at times of need, right? And that is usually the entire lifestyle intervention that we call now. I think going back to the basics is really the entire solution to it. A simple lifestyle, going back to the basics, counterintuitively, that's quite challenging, but that's what we're here to decode.
Thank you for that very, very interesting bringing together of the mind and body as a single unit, and how working with the body can really change the emotional landscape. And what I also hear you say is, it's not a quick fix, of course. It's like working towards building a muscle. And then when that muscle is nicely developed and matured, then it comes in handy for us to be able to use when we really need to.
Absolutely, yes.
That's very fascinating. So I hear you talk about your yoga and breath. So that brings me to the question, what exactly is clinical yoga therapy? And how is that different from, generally how yoga is practiced across? Like, I feel yoga is really a buzzword now, not just in India, everywhere in the world. How is this different?
Okay. So I think important question. Let's look at it from this angle of disease, health, and wellness. Right? So let's look at a general yoga class. Now, if I am a healthy individual, I have a healthy body, healthy mind, I can move myself from this place of health towards wellness. And I can go to a general yoga class, a traditional yoga class, a hatha yoga class, a Iyengar yoga class. I can do that, yes? Now, but let's say that if I'm somebody with a disease, any kind of disorder, right? Then I would require a little more intervention. I need to work differently, right? So then I would look at yoga therapy. Because let's say if it's somebody with diabetes, a metabolic disorder who walks in, now as a yoga therapist, I need to understand more about that condition.
Right.
Because if somebody walks in with diabetes, they may also walk in with a lot of comorbidities associated with it. Right? It could be other conditions medically.
Yeah.
So I have to be aware of that as a therapist. Because then I have to curate and curtail my intervention according to that, so that the practice is not harming them, rather helping them. Right? Now, similarly with regard, so I hold my specialization in, let's say, mental health conditions. So if somebody walks in with anxiety, let's say if somebody walks in with a generalized anxiety disorder, and I have to also look at them from two angles, as a mental health professional and also as a clinical yoga therapist. Right? So then if it is a generalized anxiety disorder, then is it somebody walking in with, let's say, a lot of panic attacks?
Right.
Is it somebody with PTSD?
Right.
Is it somebody with, let's say, phobia? Right? I need to understand what that person needs and what they're coming in with, understand their symptoms. And then I have to also evaluate and see how my intervention can help them. Right? So if somebody walks in with anxiety, then I can't just put them through Surya Namaskaras and say, practice Surya Namaskaras.
Yeah.
It may not work for them.
Right. It may just aggravate an existing condition.
Yeah. Or also I have seen and heard from a lot of clients who tell me, right? They say, I have practiced yoga before and, it didn't work for me. And then when I ask them why, they say, no, they asked me to sit and meditate. Yeah. And that would not work because you have so many thoughts coming into your mind.
Yes, that's counterproductive.
Yes, so if I ask somebody who walks in with anxiety, because that's what you think, right? You think, I need to calm them down. Yes. So let me put them through a guided meditation. Let me ask them to sit in meditation. Go for Vipassana, but that would aggravate it further. Right? So then I will also have to be very careful to understand what kind of intervention, what kind of sequencing that person will need. Right? And put them through that kind of an intervention and module of care. So from there, so I think also it's important for each a therapist or a general yoga teacher to understand their own strengths and limitations and cater to what they are specialized in. Right? Because if you're not because we're dealing with a clinical population. Right? And it's important to have the expertise and also the knowledge to be able to address somebody who walks in with a clinical diagnosis. Yeah. So to help them, I think from that journey of disease towards health is something that clinical yoga therapy will aid in. Right? And from there to take them onwards to the journey of wellness.
Right.
So that's how I would look at the difference of general yoga and clinical yoga.
It's more person specific. It's tailored to their very specific requirement.
Yes.
Just like eating generally healthy food is very different from eating for a specific health condition.
Yeah.
Right?
Absolutely, yes. And so I think to have both the right intention and the right expertise and the knowledge backing it is important for the therapist. And especially if you're dealing with somebody with a clinical diagnosis, I think it's important to have that, to then move into helping them and working with the client.
Yeah, that's interesting. And while I was going through your profile, I read that you've done a double master's in psychology and then in yoga, and then you went on to do a Ph.D, bringing together yoga and psychiatry. And I was wondering, what really brought you here? Like, what about this was resonant in your life that led you to this crossroads and this bringing together of two hitherto not very we've not really known the two going together very well until now. I wonder where that came from.
Okay. So for me, honestly, I didn't think that I'd probably pick this up as a profession myself, right? So my journey that way, I think from my childhood, I've been introduced to yoga, but I've been introduced to the philosophy of yoga rather than understanding it as an exercise.
Right.
So my grandparents were into yoga, philosophy. So Bhagavad Gita, Ramayana, these stories were just told to us when we were growing up as children.
Right.
Right. And verses from the Bhagavad Gita, which talks about yoga. Yes. So this is something my grandfather would just talk about for all of us, right?
Yeah.
So it's something that I grew up with listening to. And I think early on in my life, I would attribute yoga to a way of living rather than look at it as now how the whole buzzword is about exercise or looking at it as fitness.
Yes.
So I think that came about then. But later, yes, I was in a corporate job. And I realized probably a blessing early on in life that was not what I was cut out to do. The wake-up call was, so we have these annual health checkups in the company. And you won't believe it. So the average age of people working in my firm then was 28, and about 70 to 80% of them had diabetes.
Wow.
And that for me was, I was in my early 20s, and that was a wake-up call. I said, I mean, yes, I don't think this is what I would do to myself in the long run.
Yeah.
And I took that step then to change the streams that I was with. So then came my master's research work. And with my master's research work is where I went on to Nimhans. And my research work was about Ramayana. And we were looking at counseling aspects from Ramayana that could help address people with common mental health disorders.
Beautiful.
So we were looking at how concepts from that could be taken out for people with depression, anxiety, right? And I was working on that, and that really, I think, inspired me to take on a Ph.D. in the similar line, because I had a background of both psychology and this ingrained together.
Right.
And this is also something culturally very relevant, right? Because Indian population would connect to this better.
Yes, we've all grown up listening to stories from Ramayana and Mahabharata and Bhagavatam like all our lives.
Correct. And there's so much of psychological aid. These are books of psychology. They look and address the mind a lot. And my PhD also was on this. So I looked at how we could bring about a counseling framework from yoga philosophy and apply it on people with clinical diagnosis of depression, anxiety. And it was one of the first in the countries because nobody had structured. Because even when it comes to research work, there's a lot of research in yoga therapy that's being done with regard to psychiatric disorders. But they've looked at the yoga practice of it. To look at asanas, pranayamas, right? But we've looked at how this affects mental health conditions. But a large portion of the philosophical potential of yoga had been left out. So that is the gap that my research also bridged.
I have a question here, and maybe I want to just kind of like also clarify and expand on this point for our viewers. Because you rightly said, when we think of yoga or when we talk about yoga, generally speaking, it is about practices, asanas and pranayamas and postures or different schools of yoga. But there's actually not much conversation generally about the philosophy of yoga. And yoga is really yoga, right? Union. And I'm curious if you would want to speak a little bit about that, yoga as a philosophy, and how that ties in with your work and how that impacts your work with people in this area.
So even with my research work, I was diving deep into Patanjali Yoga Sutra and Bhagavad Gita. Right? So the first sutra of Patanjali is Yoga Chitta Vritti Nirodha. And this text, I would say, is very, very scientific. Now, in our scientific research, we first state our objectives and goals. That's what we're required to do. Then we move into methodology. Then we go into our research procedure. Right? And this is exactly how the Patanjali Yoga Sutra is. If you look at it, there are 4 chapters and it's very scientific. So Patanjali opens with the statement of Yoga Chitta Vritti Nirodha, which is his objective. He says yoga is to bring down the afflictions of the mind. So that is my core theme. And the Yoga Sutras is, it's extensive. It's about 195 sutras.
Right.
And there's only one sutra that actually talks about asana, which is the physical.
Out of the 195 sutras?
Yes. The word asana is mentioned in one sutra.
Wow.
Everything else revolves around, a lot of psychology, my mental health, cognition, interpersonal relationships, a lot of sadhana, practice of how I should be as an individual, my moral conduct, my social conduct, right? So it's very holistic again in that sphere, in that sense, because it's not looking at you, and there's not a lot of emphasis in, a lot of, let's say, material success. It's to really dive deeper within, and it is about practice. It is about abhyasa, which is the foundation of what are you doing on a day-to-day basis.
Yeah.
Right? So the Yoga Sutras is really a very scientifically laid out plan, but it needs a lot of decoding, right? Because I think if I just read it, I may not be able to dive deeper into it. So it's something that you need to work on with a teacher, maybe understand the deeper connotations of it. And the challenge really is that as well, right? How can I translate? In my research work, that was the challenge as well. How do I translate something so philosophical to make it applicable for me on a day-to-day lifestyle?
And that's actually what I'm very curious about right now, that because I'm somebody who leans a lot towards the scriptures, so what I hear you say resonates deeply with me. But for somebody who is agnostic to Indian culture or yogic culture and philosophy, and yet wants to dip in the Ganga, yet wants to partake in this, how can it be made relatable? Or how do you really use it in your work with clients who probably don't come with this background?
So Nidhi, another thing is, so the entire text is well, right, in the Yoga Sutras, it's not religious at all. It doesn't talk about a god, it talks about Ishvara, but the concept of Ishvara is the supreme being. So it is not religious, you don't have to sit and worship. It is agnostic. So somebody who's agnostic can embrace yoga, right? I'm not talking about faith or so. Maybe I'm talking about principles.
Right.
And these principles could be surrender. Right. These principles could be gratitude. Right. This is what the Yoga Sutras talk about.
Right.
Rather than talking about worship or so.
Right.
And it's more about your own practice and internal journey. So there are tools and techniques that you can follow, right? There are, of course, it talks about pranayama, certain tools. With pranayama, what is the effect that's happening? Can we move from practice to a state of maybe introspection, right? So if you are agnostic, I would say yoga is something that you can definitely embrace, right? And start from there and see where it would lead you to. Yeah.
Interesting. And so how do you bring it into your work? Like, how does this reflect in your actual day-to-day work with clients?
So a lot of my work with my clients now is also based on the research work that I have done in Nimhans. So long journey. I spent, I think, about 4 to 5 years decoding all of this, bringing it out into practice, making tools out of this, right? So now that's translated into how I apply this with my clients. So I think 3 major themes that emerged from it. One is the yoga practice of it itself. Right? So yoga practice, when I say that, includes asanas, body work, right? It includes pranayama, breath work.
Right.
It includes meditation, maybe some introspective work. That's one dimension, the yoga practice.
Right.
The second component that emerged was the yogic counseling module, which was the crux of my program. So that is again to do with addressing maybe your stress, emotional regulation, right? You can come in with a lot of emotions, maybe anger, how to address that, maybe interpersonal issues, relationships, how can I address that, right? So there are certain themes and philosophies of yoga that can be applied here. And then the third component was lifestyle changes, right? Because like we said, we spoke about, it's not a quick fix maybe, but how can I start implementing, because yoga also is really about living philosophies in your day-to-day life, applying it on to your day-to-day life. So it's not about coming on the mat, doing 1 hour of yoga, moving my body and going back, right? So in that 1 hour, I am really working with my body. I'm so aware of how I'm breathing, right? So there's a lot of awareness that starts to develop. The 1 hour of my work on the mat essentially has to translate into the 23 hours otherwise of how I'm living my life, which happens with consistent practice. I think I've seen that in my own way of being, right? So no matter what you start with, maybe you start with saying I need to get fitter if you're just a healthy person getting onto the mat. But over a period of time, what starts happening is, okay, now I'm stuck in a traffic jam. So this is something my client told me, right? So this is somebody who came in with anxiety. We were working and she says, you know how traffic jams are and long hours of commute. And she said, I was stuck in the traffic jam, and I swear a lot because I get very angry when I'm driving. And that day I'm trying to, swear, and I realized, okay, I'm angry. Why am I angry? Why is this bothering me? Can I pause? And she said, I used your tool of breath work. I did that. And then I said, okay, this is not in my control. So I'm letting it go. So I said, amazing. So look at what the practice has done to you.
Yeah.
Even if you didn't apply your breathing technique there, you're aware of how you're feeling.
Yeah.
And this is the goal of the intervention. Right? So every client that comes to me, I say, this is not a quick fix. It's not about 1 hour of practice on the mat.
Yes.
How is this going to change you as a person?
Yeah.
This is something that we are going to work towards. Right? And this again, I think, is holistic health.
Absolutely.
Right? So
Absolutely.
that is the third dimension. So I think research-wise, yes, these 3 dimensions came about, and these are the 3 dimensions that I apply in my work with clients.
I would love to hear some more of your client stories.
Okay.
What kind of presenting concerns were there? How did the journey pan out? Maybe you could just briefly share about a client or two journeys that really stayed with you.
Okay. So one client who came to me was somebody who was going through a lot of interpersonal difficulties with her partner. Okay, so she would tell me immediately after the yoga session, right? So this is something she shared. She said, after the session, immediately I feel very calm and grounded. So she said what happened was after the session, we went on with our lives, and my partner was shouting and the whole chaos that's happening at home. And she said, usually I give it back. Like, somebody is shouting at me, I have the need to immediately respond, react, not respond. Right? I have to react, I have to say something back.
Yeah.
And she said that day because after doing yoga, she said for a few minutes I feel so at peace that nothing happening outside is affecting me. Right? So no matter who's screaming, what they're doing, I'm at peace at the core of how I'm feeling. So she said, I didn't say anything. And he probably took a step back because he didn't see me reacting. And then he stopped shouting. And he said, what's happening? Right? And she said, for me, that came about as a huge shift in the dynamics. Right? Because I stayed quiet, because I didn't feel the need to react. My partner stopped shouting at me. And he said, what's happening? And then we could have a conversation. Yeah. So she said, I don't know how long this is going to last, because I see this is there only for maybe 10 to 15 minutes immediately after my yoga practice, because if it was after that, maybe I would have reacted.
Yeah.
Right? But I said, that's fine. Because now you're at least able to recognize that during that time, you're able to be in a space where nothing is bothering you.
Yeah.
Right? That which is great. Maybe with consistent practice, that time of maybe 10 minutes is going to expand. Maybe that awareness is going to help you later. But so I think small stories like this, right? So, and she says the relationship got better over a period of time. And then she got her husband as well into the therapy, right? She said maybe he should also work on these practices because it's helped me ground myself so much. If it helps him, I think we will have a better relationship.
Yeah.
So I think these are stories that, that's quite inspiring, because you see a shift in one individual.
And that's rippling out to people
others
around that person.
them, right? At home, maybe at your workplace, with your friends. And so interestingly also there's research work that shows that. So in research we have studies showing how yoga helps you develop a better relationship with yourself. And so you start developing better relationships around you. And I think this is very meaningful, especially when it comes to mental health as well.
Yes.
Because sustaining good mental health is also a reflection of how our communities are at the end of the day. So if I can do this to be better and connect with myself better, I'm going to help build a community which is also going to be better around me.
Yeah.
And that's beautiful.
Yeah. So that sounds like a very inspiring client journey. And maybe we could slightly shift gears and go towards, because I know that your interest is in maternal mental health. And women's health and well-being is a subject that's very close to my heart as well. So maybe to start with the applicability of this whole construct to women's health and well-being, because women do come in with complex mind-body systems. And how do you see this serving women and helping them get to a place of emotional well-being, mental well-being?
So another, like you said, I mean, I think I'm also very interested, and I've specialized in women's mental health. So especially to do with maternal mental health, let's look at it that way. So right from the time of conception, pregnancy, and postpartum care. Right, and this is a very important period in a woman's life, the entire reproductive age. There's a lot going on, physiologically, emotionally, everything, right? And so I think to cater to that, when it comes to clinical yoga therapy, I would look at it from two angles. One is as a preventive strategy, and the other is as a therapeutic intervention. Right? So if preventive strategy, now we also have a lot of research talking about how mental health conditions during the prenatal and postnatal time, like you have postnatal depression, you have postnatal anxiety, you have even anxiety and depression during pregnancy that women go through. Right? So this could be avoided with the practice of yoga, right, as a preventive tool. Now, if I'm practicing yoga regularly, then I could avoid the emergence of these disorders, one. The other is if I am somebody who's already diagnosed with, let's say, anxiety during my pregnancy. We're talking about clinical diagnosis, right? And it's very real. Because a woman can be feeling very overwhelmed, anxious, there's a lot of fear. And this is also reflective in her hormonal health. It's reflective in bodily symptoms, which is very real, palpitations, tightness, fatigue, right? And postnatal, we hear a lot about postnatal blues, depression, postnatal anxiety. Now there's at least talk going on about it. Right? So you know that it's not to be brushed on, it's not just hormonal, right? Because it could be a clinical condition. So then how can yoga help in that journey as well? Because usually during this time, also medication is not extensively prescribed, right? Or it's not probably the first line of treatment. So then clinical yoga therapy would be a very good allied complementary therapy to be put on or to be introduced to a woman during this time. Another thing is that you have to be mindful also of, if it is during pregnancy, of which trimester she is in, so that you can curtail practices accordingly. For someone, because that's also specific, right? If depending on how you're doing physiologically, psychologically, my intervention has to be curtailed and tailor-made to that individual. And understanding, I think, overall, because there's also a lot of physiological changes happening. And it's challenging, right? You're supporting, the body is beautifully designed to equip you with all of those changes, yes. But if need be, there might be some conditions. You might have gestational diabetes. Physiologically, right, there could be something that arises. So to understand, like, the entire mental health journey, to understand the physiological changes, to understand the psychological changes, and to curtail and modify the practice as an expert, to take a woman through that entire journey, I think is important.
Yeah, and what are usually the challenges? Like, I do hear you talk about anxiety, I do, and there could be overwhelm because the body is changing, but for a woman, it can feel like my whole life is changing ahead. Things are going to look very different, my work, my other relationships. So what are usually the specific challenges that you see women go through? Prenatal, just after delivery, postnatal, what are the variety of challenges you encounter?
Like you said, so a lot of times it may not be a clinically diagnosable condition at all. It doesn't have to be, right? It could just be a lot of stress and overwhelm because of the change. So postnatal, let's say, like you've had a child, the body is going through so much change, right? So I think even for a woman to accept her own body, a lot of it could be body image issues, because my body is totally different now after I've birthed a child, right?
Yeah.
It could be, and lack of sleep. It's very real.
Yes.
Because if there is lack of sleep, then I know that physiologically there's so much happening.
Yeah.
It's very natural for you to get angry.
Yeah.
It's very natural for you to break down.
Yeah.
And the baby needs you physiologically, physically, right? You're feeding, you're nursing, you're going through so many changes. And as a woman, it's very easy to be tied to that identity a lot of times. And probably you make your identity just about that. Because you're required, you're fatigued, you're exhausted, you don't have sleep, you're nursing consistently, right? And there's a new human being that you feel is the center of your world, that you need to be there for.
Plus, there are social pressures.
Yes.
There is the mother-in-law and the mother and everybody who seems to have an opinion about what this new mother should be doing. Right. So it's rather overwhelming, wherein the woman doesn't get time to kind of start to figure out a bit on her own and find that sweet comfort space with the baby.
Right.
So it's also to deal with a lot of that societal pressure as to how to go about this.
Yes, absolutely. So many changes, right? Like you said. So I think one is the physical changes, the physiological demands for a woman. The other is the emotional demands, right? The psychological demands. And then is the societal pressure, the social demands. So to bring all of that together, and I think challenges either way, for each woman the situation is different. Now if I'm in a nuclear family setup, my challenges would again be very different, and those are real challenges as well.
Right.
Can I have a support system, right? So I think even having a support system would be great. For each one, out of their situation and circumstances would be different. But for a woman post-natally, so this is something my grandmother would also tell me, right? She would say, and she has birthed 8 children, okay? So, and she would tell me during pregnancy, now a lot of women also at changing times, yes, but this is something very true, right? So, say you have to be as active as you can if it's a healthy pregnancy.
Yes.
Till you birth.
Yes.
Post-birthing is when you should rest.
Yes.
And it's absolutely important for the woman to go through that period of recovery and to have, and it would be excellent if she has the support system that could nurture her with good diet, allowing her to rest and reset, right? And the next, I think 40 days or 45 days is for her to really just resettle and tone down, right? So, and I have had clients I've worked with who have practiced with me, who had yoga sessions one day before they've delivered their child, right? And the next day they're not in the session. So one lady, I asked her, oh, what happened? You know, you didn't show up today. And she said, I'm so sorry, I forgot to mention, you know, I went into labor like last night. And I said, I'm so happy because that's great, right? And post that, it's also as another thing I think is self-inflicted pressure as women for us as well. Because we take, maybe somewhere you need to take a pause and say it's okay as well. Allow yourself to rest. Right? And it's okay that I'm going through this at this timeline. I can get back to my work. I can get back to other parts of my identity. And I will get there eventually.
But
maybe at this time, I need to be more compassionate towards myself.
Yes, absolutely. I think compassion is the golden word that women across life stages need. It's just kind of hard to be a woman in this day and time because there's consistently social and professional and personal and familial demands, and even so for mothers, right?
True.
I have another question, again with regards to your practice with clients at various stages of their pregnancy. What kind of questions do they come up with when they approach you?
So usually I think one common question is, when can I start the practice of yoga, right? And when is it safe for me to start? So I'd say even from the time that you plan to conceive, you can start the practice of yoga. If it's a healthy pregnancy, we can do that from the time that you've conceived, the first trimester all the way till the day that you deliver or before that, right? Like I said, I've had clients who've had their birthing just one day after my yoga session as well. So, but important again is that we have a check with the gynecologist, and we see how you're doing physically and physiologically. So once there's a green signal from the gynecologist, we can start with the practices. Right? And it's also important for the work that I'm doing, right? So for the therapist to understand how you can modify and curtail practices that's specific to each trimester. Because each trimester, the requirement for the intervention might shift. So just to give an overview, I think initially the first 2 trimesters, the first trimester you can always take it slow. Right, and the second trimester is usually where you can work on a lot of strengthening of the body because you need to prepare it for birthing. So a lot of pelvic floor practices, a lot of strengthening of the body, the spine, and a lot of times the practices that we do during pregnancy is also going to help you recover post-birthing way faster and quicker, right? And this is something also research tells us that with regard to when you have a healthy pregnancy or when you're doing something that is engaging you physically with your clinical yoga, with yoga intervention during pregnancy, you can have better birthing outcomes. It can also act as an insulation for you with regard to your mental health post your delivery. So with regard to postpartum blues, anxiety, depression, it could also help you curtail that if you're practicing yoga during your pregnancy.
That's a beautiful domino effect, actually, that a certain kind of practice in place during pregnancy actually ripples on to post-pregnancy, not just in physical recovery but mental recovery as well, and to able to come back to life as the woman would have known it before, prior to pregnancy.
Absolutely, yes. So I think in that journey of pregnancy, that is the case. Postpartum, I think another common question is, when can I restart? My physical activities or my yoga practice. So depending on, again, the birthing that you've had, right, and looking at how your recovery is. First is, I would always say, yes, consult your gynecologist. Let's look at how your recovery is. Right? And post that, I think usually any time between 45 to 90 days post-birthing is good for us to get back slowly. But to get back again is a transition, and we have to be careful in how we get back to our practice as well. Right? Yeah. So those are 2, I think, commonly asked questions.
But I'm really right now speaking from a very viewer's point of view. I'm reminded of some of my friends in their pregnancy journeys and how when we would talk about their physical practice, they would be like, I guess it's okay for me to walk, but I don't think it's a great idea if I say put a lot of pressure on my belly, or if I do a yogasana, because a yogasana can stress the body in a variety of different ways. So are there some myths that are around this yoga for pregnancy, and how do you feel we could go about busting some of those myths?
I'm glad you brought this out as well, because I think physical dimension is one thing we are looking at. Yes, with yoga practice, of course, I'm also looking at strengthening my body and equipping that with everything it needs for birthing. But a very, very important dimension also is my emotional health. Because it's very real when you're a lot of women that I've worked with have expressed this, right? It's very common to go through parts of, let's say, fear, anxiety, because it may be your first time of birthing. There's so much of uncertainty, there's so much of change happening. So usually then in the 3rd trimester, during the last bits of your pregnancy, I really would want to work with you with your emotions. I need to let you know that your body needs to relax. I need to work on relaxation techniques a little more. I need to equip you with those skills, because it's not just the physical aspect of it. Walking is great, absolutely needed, and if you're doing that, that's really, really wonderful. Let's look at what other components you need to be at to equip yourself for this entire journey of birthing, and maybe even post that, right? So bringing in acceptance, maybe bringing in components of resilience, emotional regulation, and this could also help sleep, which is also one of the common concerns maybe during pregnancy.
Yeah.
Right? There's insomnia, there's difficulty sleeping. So to look at it, I think from two angles of how yoga can play in. One is at your physical level, but also a deeper aspect of how you can work emotionally and mentally with you. Look at other components of you that is also the part and tenet of your health, right? Because it's not just physical at the end of the day. And I think yoga really brings about that and brings about catering to different dimensions of your health there to help a woman. Yeah.
Absolutely. I really, really enjoy the fact that it is bespoke intervention. It's not like one yoga class for everybody. For 5 pregnant women, their requirements could be very, very different depending on the nature of their pregnancy and where their individual body and mind is.
Yes. Yes.
Yeah, thank you for explaining this in such great detail. I have found it very, very enriching. I have one last question, Dr. Raksha. I wonder if you could recommend some simple practices. It could be practices, it could be routines that any of us could kind of adopt in our lives from a very yogic perspective for mental and emotional well-being.
Okay. So I think you mentioned rituals, right? A very interesting word also, because when we're looking at mental health, I think rhythms and rituals are very centric for any of us, right? So if I can have a routine in place for myself, then I know that I could function better.
Yeah.
So if I have to look at, let's say, we go back to Vedas. In the Vedas, there is this aspect of karma kanda. There's one component of karma kanda. And this talks about rituals. Yeah? So it could be anything. This talks about basic rituals that I can do on a day-to-day basis. And the intention, of course, is so that I can ground myself.
Right.
Right? So something as simple as, let's say, during Sandhya Kala. So we talk about the cycles again, right? Because cycles, be it in the nature, it could be the sunrise, it could be the sun setting, it could be the phases of the moon, it could be seasons, and these have an effect on how we feel as well. Right? So now there's something called seasonal affective disorders.
Yes.
Right? With depression, you say that if you're not exposed to the sun for a long time, that could really affect your mood. And in countries where they don't see sun and there's just snow all around, there are people who have episodes of depression, mood disorders, and it's real.
Yeah.
So we know that nature also has an effect and is in synchronization with how we feel, right? And so especially the sun, I think the sunset and sunrise is usually a good time, and there's also a lot of changes happening to us mentally.
Right.
So if we could have some rituals around this time, right? I think times way back, right? They would have rituals around this in order to, let's say, okay, they would say to offer your prayers, or go out in the sun, take a dip in the river, right? Go out or be a part of a community where you can go serve or be part of offerings or prayers, right?
Or even simple practices like, I know we light a lamp in the house in the evening when exactly at the time of sunset.
Yes, like you said, yes, rangoli.
Yeah.
Right? So these are, we would think that, okay, these are actually mindful practices that you're doing. When you're doing your rangoli, you're so involved in doing that. It's like mandala drawing now, right? We call it mandala drawing. That's exactly what they would do back then. So maybe do rangoli, maybe offering. So even the whole process of maybe decorating the deity, right? I'm offering flowers. This is a very mindful preparatory practice for you. So where you're focused, right? There is what we call the state of flow, because you're completely involved in doing that, right? So having a routine, maybe you're offering your prayers if you're somebody who believes in that. And you're doing this from a sense and a place of gratitude to begin your day. Now we do a lot of gratitude journaling, yes. Right? So it's just simple practices. I think if you could look at one generation before and how they were living their lives, This is just a part. There's no hoo-ha about it.
Yeah,
It's
it
a
was
part
just
of
an
my
organic
lifestyle.
part of their lives.
Yes.
There was not separate time and space kept aside for those kind of practices.
Right? And I think if we could just, so waking up was also a discipline. From there, you wake up a certain time. You, in the morning, if you can dedicate a certain amount to a ritual that you connect with, right? And I think that would make a lot of difference in how you're setting that intention and tone for the day and how you can carry on for the rest of the day. And during sunset, again, see if you can do some of these practices that you can come back to. And I think very interestingly, in our culture, it's so ingrained. Right?
Yeah.
Even with regard to how we celebrate our festivals.
Yeah.
Now, I think recently we had Makara Sankranti.
Yeah.
So then during Sankranti, what do? Right? We have Tilgul, we have Yellu Bella. Right?
Yeah.
So then there is kite flying. So what does it signify? It signifies that winter is ending, right? The sun is shifting and I'm going to have longer days now. So then traditionally what did we do? We're so wise. We said, okay, we need these things to be eaten. Groundnuts, sesame seeds, jaggery.
Yeah.
I need this because I need to, there might be fatigue that's coming in with longer days. I need more good fat in my body now.
Right.
I need oils in my body now.
Right.
So I know that I should have this in moderation, right? But I need that. So diet is taken care of. Kite flying, big thing, right? In Sankranti, yes, I'm welcoming the sun around. I need to go and expose myself in the sun. And I'm taking in a lot of vitamin D.
Yeah.
And that's happening without me consciously, saying I need vitamin D. I'm
also
doing it
a sense
with
of
fun.
community in
Yes.
that. Stepping
Yes.
out, because wintering as a phase is coming to an end, and now my mind and body are ready to step out and commune with people.
Yes. And again, if it is crops, then that whole thing is happening.
Yeah.
And how am I doing this again? I'm doing it as an offering, right? And I'm doing it at a backdrop of being grateful, showing my gratitude, maybe offering prayers. Community, like you said, so go distribute this to your neighbor. As a young girl, I remember I would do that. We would take sugar cane, right? Go to a neighbor. It's a sense of community again, coming together. So I think in yoga or Ayurveda as well, we look at this, I could say there's 3 components: ahara, vihara, vichara, which is very central. So ahara, how is my diet, right, on a day-to-day basis? Vihara, with my activities, right? Like with the festivities, it's probably kite flying, going out, right, and meeting people. And then is my vichara. Vichara is my state of mind, or how my living philosophies are. So how am I operating? Or how is my value system? So I think at the end of the day, when it comes to yoga, it's coming together of all of this. Ahara, vihara, vichara is very central, right? And can I bring this all together and weave it together on my day-to-day life, in my day-to-day life? It doesn't have to be a big change. Can I start with just waking up and having a small ritual that will ground me? What is it that I connect with? Right? Like you said, offering flowers or rangoli, lighting a lamp. It could be breath work. Can I just sit and do some guided meditation practice? Some basic breath work. Right? And can I unwind my day also with a ritual like this? So having some rituals to reset ourselves during the beginning and the end of the day, and it doesn't have to be long. I think you can take 10 minutes out of your day to do that. And that will set the tone for the rest of your day.
Absolutely.
So,
I so love it that you are talking about bringing back traditional wisdom, ancient wisdom. And it's also very gratifying to hear that it's all now research backed, that there is a lot of merit in how our grandparents would live their lives or how our parents would live their lives. And maybe for us, in our own ways, whatever is possible and feasible, for us to incorporate some of that back, bringing this wisdom back into our lives.
I think that's the right word, the wisdom of bringing it back together. And like you said, yes, some of these are researched now, and it's backed scientifically, right? So to really just practice and live our life in a simple way, I think is great to get back to having a life that is full of well-being as a whole gamut,
Yes.
not just as physical well-being,
Yes.
but looking at it as physical, emotional, I think mental, even spiritual well-being, because
Absolutely.
that's a huge component
Yes.
to how we operate and
Yes.
live as well.
And that is really what we are talking about when we talk about holistic.
Yes.
So I think we have more than one definition of holistic here, and we've really been able to unpack it and deconstruct it and look at so many different aspects of it.
Mm-hmm.
Dr. Raksha, would you like to speak about some of the common myths that you encounter about mental health?
Okay. So, some common challenges or myths that people come in with. One, I think, is with regard to clinical yoga practice itself, right? So, when somebody is told about it, the first thing that they tell me is, "Arey, I have a yoga class next door.
Right.
Right? I can go and practice there."
Right.
So, educating them, and this was also something that came about as a reflection in my research work. Right, because they connect. So they would say that I look at Baba Ramdev doing yoga, and that's general yoga, right? That's not specific to a disorder, probably. And they'd say, or I'd have somebody next door teaching me. But that differentiation of clinical yoga therapy is different from a general yoga practice. I think is very important, especially when you're dealing with somebody with a clinical diagnosis and a condition, right? Because there are so many things at play.
Right.
Nuances like comorbidities, some understanding about the condition itself, right? So I think that is one, and a lot of awareness I think is needed, and I think you're doing a great job at Heal Care by doing that as well, right? Promoting the right knowledge for people to be aware and to be able to differentiate that, so that I can go to somebody who is an expert and who has learned this and has the knowledge to back this. Right? Because I don't want to aggravate my condition by doing the wrong practice. That's one. Another thing I think is a lot of caregivers of people who are going through mental health condition think that it could be self-inflicted. Right? So they ask me. So of course there's a way of evaluating it and understanding it. So one end of the spectrum is that, because I think even if it is diabetes, even if it is let's say cholesterol, or you have a heart condition, and there's more acceptance, because yes, biologically, these are my markers, this is what is happening, and there's more acceptance. Okay, this is what you need to do to get better. But when it comes to mental health, there's a question mark, because I'm looking at how do I know I have depression or anxiety. And then the caregivers are like, is this self-imposed? I mean, he's just saying that he has depression. He can just come out of it. But we need to understand that it's deeper. Sometimes it is because mental health is a bigger spectrum, and usually we call that a biopsychosocial model. So there could be a play of your genetics. There could be a play of your psychological construct. It could also be environmental. Right? So to assess and understand how the individual is doing, which has to be done by a psychiatrist who is trained doctor, who's a medical doctor, and then to go on through the journey of therapy, I think is important. Right? That's another common myth, I think. The other end of the spectrum is now the challenge is that because there is so much talk about it on social media especially. You have Instagram reels, you have influencers talking about it without the right information and without the expertise. I think you have to be very careful who you're listening to. Right? Because so many of my clients come in and they already know all the terms. They come in saying, I have ruminating thoughts. I have a negative spiral. I have anxiety and depression. I am compulsive. They're picking up vocabulary which is very researched, scientific, which is very a professional's vocabulary. Instead of actually describing how they're feeling. So I think it's already, there could be a problem of overdiagnosis. Because you've read so much about this, you think that you have it, you've seen reels around it, and now you're coming and describing to me that this is how you're feeling. And for me, I have to listen to you because you're my client, and I have to listen to how you're feeling. So then I tell them, leave everything aside, tell me what is happening to you. Describe to me the emotions that are coming to you. Because there's also, you don't know what's leading to that. sometimes it could also be a metabolic condition that's causing this.
Absolutely.
Right? If you're somebody with, let's say, hyperthyroidism, then yes, you might be going through depression or anxiety that's associated with it.
Yes.
But you may not know about it.
Yes.
So it's again necessary for me to go to a medical professional to evaluate myself before I come in with a self-diagnosed disorder for myself when I'm coming to a professional or to a mental health expert, right? So that's, I think, another common challenge that's come about now. And I think it's important to understand the difference between a professional versus an influencer,
right,
who talks about mental health.
Right.
Yeah.
Absolutely. I feel that discernment is absolutely essential in being able to navigate this very complex, overstimulating world of social media. And that actually brings me to the next question. Life as it is right now is rather hard. There's just so much happening. Life is not just fast-paced. It is very overstimulating. There's constantly a lot of bombardment for people across ages. I wonder if you could recommend simple well-being practices, because I hear a lot of people talk about stress and anxiety that they deal with on a very, very regular basis. So could you recommend simple practices, asanas, pranayamas, mudras that you feel could be helpful?
Yeah, I think like we spoke about that whole connection of mind with our breath and the body, right? So if I have to just talk about, let's say, body, then largely I think if you are somebody who's very stressed going through that, chest openers are great for you to work with. Right? So because I'm opening my chest, I'm breathing better, I'm creating more room to breathe.
Right.
Because you know that when you're stressed, your breath is also affected. So something as simple as working on postures that will help me open my chest. Right? So maybe if you're healthy, of course, and if you're guided, maybe a few of chest openers, back bends, right? If you're working on those are great for you. If you're working on breath work, pranayamas like Brahmari, pranayamas like alternate nostril breathing, Nadi Shuddhi. These are simple techniques but very effective. So I think implementing this on your day-to-day basis is great, but also learn it from a person who is a professional, who knows what they are doing. That's also important, who can guide you through this. All right. So physically, you can work on those practices that will aid your breath work and your breathing better because of your posture, which is now better, right? Because the entire, I think, central theme is the spine when it comes to our practice of yoga asana. So my teacher would also tell me, you are as old as your spine is, right? So if your spine is feeling good, upright, right? And if I can work on my spine better, I breathe better. If I breathe better, I feel better. So I think these small routines, right? Work on chest opening, work on Nadi Shuddhi. Brahmari also has an excellent effect in immediately calming the mind down. There's also a lot of research data backing it on how Brahmari helps in working with certain brain networks. And so there's a part responsible for fear in our brain, which is called the amygdala. And practicing Brahmari immediately helps with that. So we've seen that it regulates that part of the brain. So there's immediate calming down. Right? So those are great tools for you to practice on a day-to-day basis, I think.
Thank you, Dr. Raksha. I think I absolutely enjoyed this conversation.
Thank you, Nidhi.
Thanks a lot.
Likewise. Thank you for having me.
So that was our conversation with Dr. Raksha Bhide. I feel that I have understood holistic a lot more today. And I hope this has been valuable for our listeners as well. Stay connected because we are bringing in a lot more conversations with holistic practitioners.